Assalamu alaikum wa rahmatullahi wa barakatuh. Hello everyone. Today inshallah we will complete our lesson in module 100 about blood. So let's get started. Anticoagulants. Okay. Now the definition of the anticoagulant is: it is the substance prevent blood clotting. It's simply prevent the pathways of blood clotting, the intrinsic pathway and extrinsic pathway. Okay, there are two types in anticoagulants. In vitro means outside the body, and in vivo means inside the body. Okay, let's start in vitro anticoagulants. Simply, in vitro anticoagulants is prevent blood clotting outside the body and inside the body. So, two pathways. It works in test tube, in lab tests, okay, by three ways. First way is to remove calcium ion, as you see, yes, remove of calcium ion by oxalates. It is precipitate calcium as salt and citrate used in blood transfusion. Okay, deionizing calcium ion. We said before, calcium is essential for clot formation. Now we are say these important details, that the calcium which must make, or the calcium is sharing in clot formation, must be ionized, must be right with it 2+. This is very important. If calcium didn't have these two positive charge, it will not share in clotting. So citrate make deionizing the calcium ion, and oxalate precipitate in calcium as salt. So this is the first way. The second way in vitro is silicone coated tubes. Okay, the tube like this. Okay, inside the tube, okay, let's imagine this is the content of blood. Okay, imagine content of blood. The inside tube, okay, the whole tube is contain silicone. Okay, why? Because silicone is very smooth. It is very similar to our endothelium structure like. So, clotting factor number 12 and platelets will not get activated. So factor 12 and platelets will not get activated because the surface is very smooth, similar to our endothelium. The third way is heparin, and inshallah we will discuss the heparin in vivo inside the body specifically. Okay, inshallah. Now let's go to the second way for anticoagulant, which is in vivo anticoagulant. It is simply prevent clotting inside the body. Okay, it is by two drugs. The first drug is heparin. The second is dicumarol. So let's get started in heparin. The origin of heparin from mast cell and from basophils. From mast cell and from basophils. Okay. Its action, it is simply facilitates the action of antithrombin 3. As we learned before, antithrombin 3 is very important in anticoagulant pathway. Okay, so it is block activity of factor number 9, 10, 11, and 12A. All A. A means active. Yes. That they site in vitro and also in vitro, inside the body and outside the body. So the action of heparin outside the body is by facilitating the antithrombin 3, means blocks activity of factor 9, 10, 11, 12. Simply. Let's back in vivo. It is also very rapid, and because he is very rapid in onset, his duration is very short. Yes. The administration of it is by injection. Okay, injection. The antidote of heparin is protamine sulfate, 1%, and blood transfusion. Why blood transfusion? Because the plasma inside the blood, okay, and plasma proteins, yes, the plasma contain plasma protein, as we know. One of the plasma protein, as we learned before, is prothrombin, and prothrombin has a very important role in clotting formation. Yes, so blood transfusion and protamine sulfate is the antidote of the heparin. It is normal important in MCQ. Just don't forget it. Let's move to dicumarol. It came from plant. It is action by competitive inhibition of vitamin K. Okay. This drug also we called warfarin. Yes. Memorize the name well. Don't forget the name. Warfarin is the same of dicumarol. Yes. It is competitive inhibition of vitamin K. Vitamin K is very important in clot formation. So, if we prevent vitamin K, we will prevent factors number 2, number 7, number 9, number 10. So, we will close both pathways, the extrinsic and the intrinsic. Yes. And that in vivo only. So, if he said one, for example, okay, one of these drugs cannot work in vitro, and he mentioned a lot of drugs that you didn't know each of them, you just know the warfarin and the heparin, it is not problem. You have studied that the only drug that is not working outside the body is warfarin, or as you can say for it, dicumarol. Yes, it is very slow. For your clinical information, the patient in his first day to take warfarin, okay, we didn't give him warfarin alone. We gave him firstly, okay, in first 3-4 days, we gave him warfarin with heparin, because heparin is fast. So warfarin needs some days to be active, okay? When he active, he is very long duration. Let's move us to another section. Yes, so he is slow in activation, slow in onset, but he is long in duration, unlike the heparin. Okay, it is taken orally. Yes. The antidote of warfarin or dicumarol, as he is a competitive with vitamin K, the antidote, of course, it will be vitamin K. And the antidote also will be blood transfusion. If you forget this information, it is not a big deal, okay? You can just memorize that if I want everything to get back again, just make a blood transfusion. Yes, that's it simply. Okay. Let's move to abnormalities of hemostasis. The abnormalities, yes. Okay. Firstly, we will talk about conditions that cause excessive bleeding. Excessive bleeding. Or meaning, that mean very slow formation of clot. Yes. Firstly, thrombocytopenic purpura. Yes. It's mean that platelets deficiency under 50,000 platelets. That causes subcutaneous hemorrhage. Petechial. Okay. You can say there is a kind of pigmentation on the surfaces of patient's skin. Yes. And it is diagnosed by prolongation of bleeding time. Okay, it's very important. Prolongation of bleeding time. The secondly causes of excessive bleeding is vitamin K deficiency. Now we will learn the importance of vitamin K. So, vitamin K is a fat-soluble vitamin formed by intestinal bacteria flora. If you would like to know the fat-soluble vitamins, it's very simple. It just like كده. In Egypt, okay, كده means like that. So, vitamins كده, all of them is a fat soluble, simply. That's it, simply. Okay. Vitamin K, vitamin E, vitamin D, and vitamin A. This is for your information. So, vitamin K is essential for formation of factor 2 and 7, 9 and 10, which are formed by liver. Yes. So, this is very important vitamin in clot formation. Okay. Let's move to causes of deficiency of vitamin K. He is formed, as we said before, in intestinal bacterial flora. If there is an absence of this flora, okay, as in newborn infant, or prolonged antibiotic use in adult, there will be deficiency in vitamin K. This is a cause. The second cause is obstruction of bile ducts. Yes. And this diagnosed by prolongation of clotting time. This is very important. The previous disease is diagnosed by prolongation of bleeding time. So, let's simply imagine this is a hand, okay? Simply imagine. If this person cut his finger, okay? This wound will just bleeding, okay? There is a test, we will know inshallah about it, we'll discuss about it, okay? If this bleeding take time, and inshallah we will learn about, discuss all details about these tests. If takes time, that means thrombocytopenia. But if there is a prolongation of clotting time, and inshallah we will know the difference between them, okay? It is mean that vitamin K deficiency. Now, let's move to hemophilia. Okay, it is a congenital sex-linked disease on chromosome X. It is recessive and carried by female to their male son because it's transferred by X chromosome. Yes. It is 3 types: hemophilia A and B and C. A means absence of factor 8. This is most common and called classic hemophilia. Hemophilia B, the absence of factor 9, and hemophilia C, absence of factor 11. It is characterized by severe bleeding even after mild trauma. Yes. And also diagnosed by prolongation of clotting time as vitamin K deficiency. So we can difference between hemophilia and vitamin K deficiency by severe bleeding after mild trauma. This is a main character of hemophilia. Okay. That was condition that cause excessive bleeding. Now let's move to condition cause excessive intravascular clotting. Thromboembolic condition. Yes. Because slow blood flows, okay, as in prolonged bed rest after operation and varicose vein. Also a roughness in endothelium in atherosclerosis. As we said before, the platelets are activated if just the structure of the surface of endothelium isn't too smooth. It's activated and make a thrombus. So the structure is very important. And also slow blood flow. The fast blood flow is important to prevent clot. If it is slow, as we said before, the platelets will stuck to each other and activate it, okay, and make a thrombus. Yes, and also in varicose vein. Inshallah later we will discuss about it. But varicose vein simply means the blood is congested. Let's imagine this is a leg, okay? So the blood inside it is stuck. Okay, it is stuck. Didn't go up. So blood stuck. And the veins is being prominent. You can see it under the skin. Okay? It affects mainly the any people who work and standing a lot of times, like surgeons, like builders. Any job that make you stand a lot of time will make a varicose vein. Yes. Now let's move to C, conditions. Excessive bleeding, make excessive bleeding and intravascular clotting. Okay. It's also called disseminated intravascular coagulation, both of them. Yes. Means wide spread clotting, okay, plus bleeding tendency due to consumption of clotting factor. Widespread clotting and bleeding tendency due to consumption of clotting factor. Simply, if you want to imagine this, okay, the full human body, its main, this is a character, okay? Okay. Let's imagine this person, the all clotting factor inside his body, okay, stuck in his leg. All main platelets in his body now. Okay, main factors inside his leg. Stuck in his leg. Okay, we will inshallah discuss the reasons or causes. The main body didn't have platelets to make clot, and inside his leg a huge number of platelets make a thrombus. That's it. Okay, the causes of it is due to massive thromboplastin production from traumatized tissue. Yes. For example, retention of dead fetus in uterus for weeks, or in septicemia. Yes. This is an example for it. And it is very rare condition. Yes. Now let's go to hemostatic function tests. Okay, let's discuss it specifically. The first test is blood count and blood film. Sorry. Platelets count is decreased in thrombocytopenia. Thrombocytopenia means, from its name, simply, okay? Thrombo means thrombus, okay? Cyto means cell. Penia means decrease. So, simply from its name, thrombocytopenia means decrease in platelets count. This first test. Second test is a bleeding time. Okay? It is the time needed for bleeding to stop without clotting. Okay? It takes from 1 minute to 3 minutes. Yes. Depends on platelet count and platelets function. If it's normal, the bleeding time will be normal. Okay. If it is abnormal, it also will become abnormal. So, prolonged in thrombocytopenia purpura. Why? Because as we said, depends on platelet counts. If there is a low number of thrombocytes or platelets, it will not stop the bleeding. So let's move to third test. It is blood coagulation tests. It's also many of tests like coagulation time, coagulation time is time needed for blood to clot. Take from 3 minutes to 10 minutes. It's prolonged in extrinsic and intrinsic system disorders like vitamin K deficiency and hemophilia and liver diseases. Okay, we discussed why vitamin K deficiency and hemophilia. Now, liver diseases, because as we learned before, liver is the factory for plasma protein and for all factors. Okay. The second test is prothrombin time, specifically for extrinsic pathway. Extrinsic pathway, as we learned, it is the fast pathway. Yes, it's phospholipid substance. Okay, thromboplastin and calcium are added to plasma. Normal value is 15 seconds and prolonged in vitamin K deficiency. So, if we want to differentiate between vitamin K deficiency and hemophilia, we just make one of these tests or the next test, okay? Prothrombin time test or activated partial thromboplastin time. Okay? If we think that this patient has a vitamin K deficiency, okay, we will make prothrombin time, okay? If it take a prolonged time more than 15 seconds, that means there is an abnormal in extrinsic pathway. That is mean there is a surely vitamin K deficiency. Now, activated partial thromboplastin time, or if you want to say it, APTT, test for intrinsic pathway. Intrinsic pathway for factor 8, 9, 11, and 12. Yes. Modulate thromboplastin and excess calcium are added to plasma. Normal value 14 seconds, 30 to 40 seconds. It is prolonged in hemophilia. Yes. Coagulation factors are classified into 3 groups. The first group is fibrinogen group. It's work at factor 1 fibrinogen and factor 5, 8, and factor 13. It is activated by thrombin and consumed during clotting. The second group is prothrombin group. It's contain factor 2, 7, 9, and 10. It is need vitamin K for synthesis in liver. Okay. Contact group is contain factor 11 and factor 12, activated by contact to electronegative charge, not consumed during coagulation formed in the liver. Okay. Now let's move to simple subject about blood groups. The blood, as we know, it's classified into 4 main or 4 blood groups: A, B, and AB and O. Simply ABO system. Okay. This means simply we will imagine 4 blood cells. Okay? 4 blood cells. Let's choose the blue color for antigen A. Okay? And the green for antigen B. Okay? This is A. This is B. This, the naked one, is O. And finally, this and this is an AB antigen, simply. Okay? So, the group A contain antigen A. The group B contain antigen B. AB contain antigen A and B, and O didn't have any antigen. That is simply. Yes. Now let's move to this. Okay. So, AB, also called universal recipient. It's take from all. And O, it's called universal donor. It is give all. So, that is simply. The antigen, as we said, it's very simple. We didn't need to say it again. Okay. Antibody for it. For A, antibody B. Anti-B. Yes. And for B, anti-A. Okay. AB, the universal recipient, didn't have antibody. O has anti-A and anti-B. Yes. So, simply, AB group, it's easy to take from all. And group O, it's hard to take from all. Yes. The most common is O. And the less common or the rarest blood group is AB. Yes. The importance of blood group determination. Firstly, in blood transfusion, a cross-matching test is done. Means recipient serum antibodies mixed with donor's blood RBCs to avoid incompatible blood transfusion that result in agglutination. Yes. Reverse layer occur due to dilution of donor antibody in large volume of recipient blood. That first. Secondly, medical legal good negative tests to exclude, not to prove paternity. Yes. Now let's move to RH factor, and you can call it D factor. It is discovered in rhesus monkey. Okay, 85 of RH is positive, 15 of RH is negative. Both have no anti-D. That's it. It's only formed in RH negative persons if receive antigen D. Okay. RH positive blood becomes sensitized. If that person receives RH positive blood again, will result agglutination and hemolysis of RBCs. We will discuss this in a disease, inshallah. It's very simple, okay? The importance in this disease, it's called erythroblastosis fetalis. Means simply rhesus hemolytic disease of a newborn. If a male have a positive RH, okay, married with a negative female RH, okay, the baby will become positive RH as his father. During delivery, as you said, there is a connection between the fetus and his mother in blood. So, the positive fetal blood enter maternal circulation, and the anti-D is formed inside the mother's circulation. blood circulation. Anti-D. In next pregnancy, the anti-D which formed before, okay, crossed the placenta. So the mother has a anti-D, anti-positive RH, which the baby have a positive RH. So make agglutination and hemolysis of fetal RBCs. Yes, that will translated after the birth in baby will have anemia and obstructive jaundice because they increased bilirubin. Okay, and connectors. Bilirubin cross blood-brain barrier. Okay, that will make retardation or badly, unfortunately, bone dead. To prevent this, simply, firstly, Rh negative female should never receive Rh positive blood. B anti-D is given immediately after delivery to neutralize D antigen and prevent sensitization. First baby affected in previously sensitized Rh negative mother, okay, via previous transfusion with Rh positive blood. So the first baby will be normal. The second and third and next babies well affected. So no fatal complication regarding ABO system, as ABO antibodies cannot cross placenta. This is important information. Secondly, repeated blood transfusion. If Rh negative receive Rh positive blood, anti-D is formed, as we discussed before. Next transfusion with Rh positive, because anti-D is formed, will make agglutination and hemolysis and as we said before. Blood transfusion, okay, indications in cases of hemorrhage to restore bloods. Restore one elements of blood, RBCs, YBCs, platelets, and in erythroblastosis fetalis. Precautions before blood transfusion. Of course, the blood must be compatible and free from diseases and contamination. Thirdly important, must be fresh and not stored more than 3 weeks at 4 Celsius and high hemoglobin. Have a high hemoglobin. Complication of incompatible blood transfusion. This is very rare, okay? But we must know it. Make agglutination and hemolysis leads to clumping of RBCs that blockage the capillaries, make backache, for example, and joint pain, anginal pain, coronary blockage, okay? Because, or we can name it ischemic pain. If capillaries is occlused, okay, and closed, there ain't enough blood will reach the system, so that system will shut down and feels pain. That firstly. Secondly, intravascular hemolysis, release of histamine will make vasodilatation and decrease the arterial blood pressure, that will make shock, and release of vitamin K will release of potassium, okay, release of potassium will make hyperkalemia, that will cause cardiac arrhythmia. Thirdly, will release of hemoglobin will make hemolytic jaundice, okay, the patient will become in yellowish in color. Okay, bilirubin is produced from hemoglobin, yellow coloration of skin, and mucous membrane, and filtrate by renal glomeruli make acid hematine. Acid hematine will blockage renal tubule that leads to renal failure, so it is very dangerous. Finally, let's move to leukocytes or white blood cells. Okay, it is mobile unit of body protective system, very important in immunity. The stiff production in bone marrow. Okay, it started from pluripotential stem cell, or as we learned before, uncommitted stem cell by interleukins, committed stem cells, and became divided and mature into two separate stem cells line. Two line. The first line, myeloid line, okay, give rise to three type of granulocyte, monocyte, and megakaryocyte. Second line is lymphoid line, give rise to lymphocytes. Okay, leukocyte count, it's normally from 4,000 to 11,000 white blood cells inside the blood. Leukocytosis, okay, means cytosis means leuko means white. Okay, leuko means white. Cyte means cell, as we learned before. Tosis means condition. Okay, disease means increase. Yes, leukocyte is increased more than 20,000. Cause inflammation. Okay. Leukemia. Leukemia is cancer. Okay, it is malignant disease of bone marrow leads to uncontrolled production of abnormal white blood cells. That the horrible increase or terrible increase in leukocytes will make it or formed it didn't have the complete function of it. So it is very weak against the foreign bodies, foreign bacteria. Yes, cannot protect the body against infection. The third disease is agranulocytosis. A means absent. Granulocytosis means rapidly fatal disease. Okay, it's bone marrow stop producing white blood cells. There is no white blood cells because exposure to radiation or drug and toxins, destroying of white blood cells formation. Let's move to inflammatory response. Response of living tissue to injury. Okay, simply due to infection, trauma, extremities, heat, cold, chemical agent. Simply local vasodilatation make increase redness and heat and vascular permeability and swelling, and you can add it pain and dysfunction. Yes. Cell involved mainly started by neutrophils, okay, and monocytes. Started by neutrophils. Firstly, there is steps in inflammatory response. Okay. Firstly, margination. Simply, it is sticking of neutrophils and monocyte to endothelial cell, reaction of some chemical produced at inflammatory site or nearby capillaries wall. The second step is the epidesis. Means both cells squeezed through pores between endothelial cell. The third step is chemotaxis. They move by amoeboid, okay, movement. Amoeboid means by pseudopodia. Okay, the cell simply, okay, extend a leg, okay, from it and push itself or pull itself toward the bacteria. Yes, toward site of inflammation by chemotaxins. Okay, the substance attract phagocytes to site of inflammation as breakdown product, inflammatory tissue, bacterial toxins. Okay, and negative chemotaxis, bacterial toxins repel neutrophils. The fourth step is opsonization, when immunoglobulin and complement proteins coat the bacteria, make them tasty to phagocytes. Fifthly, phagocytosis. Bacteria bind to receptor on phagocytic cell membrane and is engulfed into the cell. A phagocytic vacuole is then formed, which lysosome fuse and kill the bacteria. Okay, let's simply imagine what will happening. Okay, simply let's imagine this is a blood capillary. Blood is moving. Okay, the normal blood cells, okay, move in center. When there is an inflammation in any site, okay, the white blood cells, the neutrophils, monocyte, okay, these immunity cell will become slower and go to the peripheral. Okay, we'll go to the peripheral sites. This is margination, simply. Okay, then make the apidus squeeze itself from the small pores from capillaries to interstitial fluid outside the capillary. Okay, okay, now the cell become here. Yes, the third step is chemotaxis. The immunity cell go to side bacteria. Let's imagine this is the bacteria, and the white blood cell, the immune cell, go to it by chemotaxis. Okay, bacterial product, bacterial toxins, inflamed tissue. Okay, like this. There is a types of immunity cell. One of these types is called phagocytic cells. Okay, it's large. Okay, to engulf and eat, simply eat the bacteria. Yes. So some of immunity cell cannot eat the bacteria. What make? Simply make a sign above the bacteria. Okay, that's called opsonization. That's mean, come on cells, come here. This bacteria, it's ready to be eaten. And this is opsonization, as we discussed before. Okay, when a large phagocytic cell become near to this bacteria, it just eat it and make it in vacuoles, and the lysosomes, okay, go inside this vacuole and kill the bacteria simply. That is simply the inflammatory response. That was simply the blood module we have taken before. Alhamdulillah Rabbil Alameen. Thank you for listening. Thank you for watching. Inshallah, we will meet again. Assalamu alaikum wa rahmatullahi wa barakatuh.